Mads Gilbert in Oslo, Norway. He is the medical head and professor at the Clinic of Emergency Medicine, the University Hospital of North Norway. Thank you so much, Doctor, for being with us on the program. I mean, we've spoken several times over the last year, and the message has been consistent and the same. Stop the attacks, stop the occupation. But here we are still talking about Israel attacking a hospital yet again.
Yeah, it's terrible. And I just got the message from Dr. Hussam Abu Safia, the director of Kamal Adwan, yesterday. And he ends the message by asking the world. He says, "We are exhausted by the ongoing violence. We've had 5 bombardments. Why are we subjected to such brutality? Each day, the hospital is systematically targeted, and the world is standing by doing nothing." Unquote. And I think he has a very valid point. This would never have been accepted had it been in Ukraine, or let alone had it been in Israel. And the patients and the doctors and the people were Jewish people. So it's a deeply rooted racism in the global West and North that accepts these war crimes ongoing from the Israeli occupation forces.
You quoted the director of the Kamal Adwan Hospital and the teams there. They've been working tirelessly. We've been following the director very closely. He's gotten injured. His son was killed. His colleagues have been killed and injured. What more have you heard on the situation there?
Well, only that the Israeli occupation forces systematically tries to shut down Kamal Adwan, Al-Auda Hospital, and the Indonesian hospitals, the 3 remaining hospitals in the north of Gaza, which has now been under brutal siege for 60 days and nights. I mean, this is a systematic part of the ethnic cleansing of North Gaza. And hospitals are the cornerstones of a civilian society, the security network for the civilian population. So what we've heard is that they have smashed the oxygen machinery, they have smashed the solar panel, they are attacking the generators in the hospitals. They do everything they can, the Israelis, to force the healthcare personnel out of these 3 hospitals in order to land grab and to annexate North Gaza. And it's only thanks to the bravery of these medical staff, the doctors, the nurses, the medical students, and the paramedics, that these hospitals are still in some sort of function. It is long overdue that the world says open the hospitals, secure the hospitals, and stop the bombing of Gaza.
And of course, there's a whole generation now, Doctor, whose lives they've changed forever, with thousands of kids amputated. What needs to be done for them in terms of recovery?
Well, we have done research on this previously from the attacks in 2009 and 2014, and we have actually calculated that each amputee in Gaza will need a follow-up of at least 10 surgical operations on an average. Now we have maybe 7,000 amputees. That means that there are a waiting list for 70,000 surgeries in Gaza. And among the more than 1,000 amputated children, of course, there are 10,000 operations needed. So when the Israelis are destroying the healthcare system and bombing the hospitals and destroying the supply lines, it is another way of denying these children the right to healthcare. And not only the amputations, bear in mind that winter is now in Gaza. It's freezing cold. There's a lot of precipitation. They don't have any house to live in. They live in tents. And this causes hypothermia. And hypothermia, low body temperature, combined with starvation and lack of water, is killing people. So this is so cynical. It's so sadistic, the way that the Israeli occupation forces systematically perpetrate this genocide, as we are watching every day. So we need to stand up much stronger and much more outspoken. And I'm very appalled by the international medical community being so silent. It's only us, the few, who actually protest.
All right, Dr. Mads Gilbert, thank you so much for being with us here on TRT World and sharing that insight with us. I appreciate it.